This next speaker, Dr. David Kennedy, practiced dentistry for more than 30 years before he retired in 2000. In '99, he produced a documentary film titled Crippling Waters on the problems of excess fluoride in drinking water of China. He produced that smoke and tooth video we all saw this morning, years ago, which highlighted the 20 years of pivotal medical research funded by this academy. Most recently, he had a film out called Fluoride Gate, really good. If you don't have it, I highly recommend that you watch it. He is recognized around the world and a leader in the field of preventive dentistry. Dr. Kennedy is a past president of this academy. He's a master. He is currently on the board of directors and the grandfather of my 2 children. Dr. Kennedy.
Great. Thank you, Sonny. In your packets, you have a quiz, and that you're going to take it as we go along, and then answer the question like you think you should, and then but if you know me, you know the correct answer. But anyway, just to show you the stuff that we were fed in dental school, is it true or false? And so it's a really easy test. Everybody should ace it, and that the answers are on the last page. So it's a pleasure for me to address the fundamental course at the International Academy of Oral Medicine Toxicology, and I'm glad to see all these nice, bright, shiny young faces in the audience, because as I point out, you know, with the gray hair and that sort of stuff, you know, a lot of us are getting kind of our use-by date. And so it's a pleasure to have other people come in and learn some of the things that we've spent 40 years researching, and that we can answer any question you have with science. And that's, as you may have heard, that's our mantra, show me the evidence. And that's so that instead of just saying, well, I believe this. No, that's for religion. This is not about belief. It's a question of what your numbers show. And so let's talk about fluoride. The thing that some people claim is that it's an essential nutrient, and that it's so essential that it has to be incorporated into the enamel of the tooth to make the tooth stronger and harder, and it has involved in, I guess that's not true. And why is it not true? Is that the FDA is alone in being able to determine whether something is an essential nutrient or not a nutrient. And what they find is that they can take as every opportunity to remove any kind of fluoride from the diet of an animal, any animal, and that they do better if you take it away. So it's the opposite of a nutrient. So some of the stuff that I learned, these are the myths that I was hammered with in school. So you may not have heard these same things, but because it was 1979 when the FDA says remove all references to fluoride as a nutrient or a probable nutrient. I still hear people coming to city council meetings and making completely false statements. And so one of the ways that we are able to kind of keep them on the straight and narrow is we file ethical complaints against false statements made by professionals at meetings, because the obligation to make sure that your statements are truthful rests solely upon the professional. It's not the public, it's not the city council, it's your obligation. So if you're just quoting the ADA or somebody else, what you have to say is, I'm going to quote the ADA. So fine, it's not a ding on your license. But if you say fluoride's an essential nutrient, you just made a statement of fact that's wrong. And that making statements to the public that are incorrect is a violation of every dental practice act in the entire United States. And it's under the advertising, is that the professional may not make false statements to the public. And so even if you don't know they're false, topical treatment supervised in the dental office has killed children. Often it's attributed to the anesthetic. Well, what's the anesthetic? Fluorothane, halothane. Oh, those fluor. Anytime you hear fluor, like fluorocodone or fluorothane, those are fluoride drugs. And that, think about a child in a chair that gets a topical treatment. We were taught it was tropical. Well, 3-year-old child swallowed it, and that neither the dentist nor the dental hygienist testified in court that they knew it was a poison, and yet he had swallowed enough to kill 3 children his size. And so who knew that a topical fluoride treatment contained a lethal dose of fluoride for the recipient. So how about this one? We need to have the fluoride incorporated into the enamel to make the enamel harder and more resistant to the acid dissolution from those ho-hos and junk food that the kids are all out eating today. It makes them more resistant to tooth decay. So you can go ahead and drink your Coca-Colas and your Pepsi-Colas and your candy bars, and it won't hurt a thing because you got fluoride in your enamel. And no. And that this is from, I like to use the Journal of the American Dental Association on some of my references. Not that it's a particularly good journal, but at least if they're a licensed dentist who is a member of the ADA, that they probably had it lying around their waiting room someplace. And John Featherstone in 2000 summarized what his 30 years of research, and his wife's Pam Dembeston, or was, I think they're divorced now, about fluoride, and that the prevalence of dental caries in a population is not inversely related to the concentration of fluoride in the enamel, and a higher concentration of enamel fluoride is not necessarily more efficacious in preventing tooth decay. So it's not correct that the fluoride needs to be in your enamel. So that's another myth that I was taught, because that was the whole purpose behind water fluoridation, is that you wanted people to be exposed to this wonderful natural ingredient so that you swallowed it and it was absorbed in your intestine and it came out in the formation of your teeth when you were a baby. And as you grew up, your teeth were hard and resistant. Oh, I guess not. So that was another myth. So how do we get these myths? People make up things and feed them to the dentist, and the dentists don't know. They need to say, and the evidence for that is what? Don't forget that. Show me the evidence. Because since fluoride in the enamel does not make it more resistant to tooth decay, as I say, how do it work? And so that would be a question you'd want to say, does it work? Prescription fluoride, or fluoride added to the drinking water, delivers a safe and effective dose to everyone. So is that true? Oh, you guys are getting onto this pattern, aren't you? So you're going to be able to get an A on this test, I think. So putting a concentration of anything in air, water, food, does not give a dose. Dose is weight for weight. And so every time you check into your doctor's office, they have you get on a scale. And they say, oh, you weigh 175 pounds. And they use that when they decide what dose to give you, because your weight and the dose. The baby weighs 8 pounds. I weigh 175. So if you divide this, I weigh 20 times more than a baby. So the same dose to me would overdose the baby 20-fold. So you can't put a concentration in the water that's going to dose me and not grossly overdose the baby. So think about it. The estimated dose to an infant on tap water formula exceeds the dose that's known to cause harm. And so at this point, all of the advocates for fluoride exposure begin to mutter something about, oh, the harm was in those poor countries like China and Thailand and India and the Rift Valley and all those places in the world that have high levels of fluoride. And if you look at this quote, that it's not. It's from our pediatric dental journal from 1995. And what they showed was that if the child was breastfed, they didn't have dental fluorosis. If the child wasn't breastfed, or breastfed only for a limited amount of time, the more that they were given a tap water formula, the more severe dental fluorosis the child had. So if your goal is to increase the income of dentists, then yes, make everybody have spotted teeth. That's good, because then you probably could have a living with laminates, porcelain little pieces of false porcelain put on your teeth to cover up the spots, bleaching, abrasion. You can sand it off sometimes and polish it and buff it. And so why would we want to cause dental fluorosis? That doesn't seem to be a particularly nice thing to do to somebody. And let's look at the informed consent. Dear Mrs. Jones, I would like to put some fluoride in your baby bottle, and your child will grow up with teeth that are just exactly like everybody else's, except they're going to have some spots, and they're going to come in white, because the color of dental fluorosis is not part of the diagnosis. Some people say, oh, that brown stuff, that's really high fluoride. No, has nothing to do with the level of fluoride. All fluorosis turns color with time, because it is not enamel. It's, if you think of spaghetti, if you take enamel, look under a microscope, it looks like spaghetti in the package. There's a whole bunch of rods. If you look at a tooth that has dental fluorosis, there has been the child is exposed to fluoride during the time that that tooth was being formed, there's areas where there are no rods and there are voids in the enamel. It has a little glob of protein. That was what happens to the body is that when the child is born, the body makes a little, basically, protein shape of the tooth, and then with the enzyme, it comes in and replaces the protein with calcium hydroxyapatite. And that what you're seeing in the dental fluorosis is that the enzyme that was supposed to remove the protein and put in the calcium hydroxide was calcium hydroxyapatite, that what you're seeing is that enzyme was inhibited to the point where it no longer functioned properly. And so what else does this enzyme do? Fetal development, brain development, joint development, bone development, cell development. So when you see spots on teeth, that's not the only organ that was impacted. It's the organ you can see that was impacted. But if you do IQ tests, for example, you'll find that children with more dental fluorosis, the more impaired they are neurologically. If you look at joints, the more likely that joint is to become arthritic or fluorotic in adulthood. In China, they pointed out to me that the people that were the most crippled also had the worst dental fluorosis. And that's basically because they go hand in hand. And damage is not limited to the teeth. It is systemic, body-wide, if it was caused by fluoride that you swallowed. And do you know how to estimate the dose to an infant on tap water? And this is kind of an interesting exercise, is that I don't have any children, but I'm told that a baby drinks its weight in water if it's on formula every 3 days. So that means that an 8-pound baby is going to be drinking its weight in water every 3 days. Now, I weigh 107. Let's divide 8 into maybe 160. So I'd drink 20 gallons of water every 3 to 4 days if I was a baby. Huh. Boy, that'd be a lot of water. Well, that, as they say, a baby drinks a lot of water. And so if you put a chemical in the water, then the baby gets way more than the adult. And so what drug do you know you should take unlimited quantities of at any given point in the day at a level above, 20-fold above the adult? There aren't any that fit that category. None. Not even oxygen. So how about prescription fluoride? The FDA has never approved prescription fluoride, but it's political. Understand, it's political. And when you ask them specific questions, they say, no, it's not an approved drug. But if you go into Walmart, you can find it at every drugstore in the United States. Wow. So we have unapproved drugs dispensed from every drugstore in the United States. So what's the purpose of having regulations if we don't pay any attention whatsoever to the regulations' purpose? Purpose is to make sure that when you have a drug, that it has been tested and proven safe and effective. And that, so the FDA guidelines say never for children under the age of 3, and that's not talking about prescription fluoride, that's just talking about exposure to fluoride. And that it's an unapproved drug for which they have no evidence of safety. So think about who then is responsible. So if somebody should happen to receive a prescription, like I gave my sister-in-law for my nieces and nephews, for an unapproved drug, and an adverse event should occur, who would be responsible? Would it be the FDA? No, we said it's an unapproved drug. How about the ADA? No, the ADA owes no duty of care to the public. They're just a trade association. They represent the industry, not the public. So, gosh, somehow they got this prescription. Oh, whose name on the bottom of it? Ooh. So that's who they go back to when the child develops dental fluorosis. And why would I say the child would develop dental fluorosis? Sometime in the past, I contacted Colgate-Palmolive. They make a vitamin fluoride combination called polyviflors, and so I called them up and I asked them for the evidence that polyviflor was a safe and effective drug, and they sent me a study by Peebles, and it was not blinded, and it was a little study, and yada yada yada, lots of flaws, terrible study, would never get the drug approved, and it didn't, but it did show that if they give kids tablets of fluoride, they get dental fluorosis. 67% of the kids had dental fluorosis if they took the prescription fluoride. So it's basically a prescription to make your children's teeth spotted. Woo! And you can call them spot. So as determined, the pharmaceutical companies, they've ordered them to stop manufacturing vitamins with fluoride as well as systemic tablets or drops. Most recent warning was 2016. And I'm sorry to say that they managed to weasel out of that because all the dentists says, oh, the children, the teeth will rot if we don't give them tablets of fluoride. And so they are not enforcing that law. But when does the police not enforce the law? When it's politically not expedient, I guess. So here's the letter. How would you feel about getting this letter delivered by an armed messenger? Overnight delivery, and David K. Humphrey is the CEO, says cease and desist. And they went on in great detail about what he's supposed to cease and desist. And they're supposed to cease and desist manufacture, distribution, sales, advertising of fluoride tablets, fluoride drops, fluoride mouthwashes, fluoride vitamins. They sold them all. They said cease and desist. And so I call it the not, never, and never, ever, because it's not FDA approved, it's not safe, it's not effective, never in children, and never, ever without informed consent. The lowest concentration approved for topical self-application is 1,000 parts per million. That's Crest. Colgate's 1,500. And read the warning. It says, spit out after you brush your teeth, because they don't want you to swallow. So clever scientists decided to look at children and see how, anybody that's raised a child knows that if the baby's crawling around the floor and picks up a penny or something like that, mom's off the couch like a shot from a gun, because she's got to get her hand on that penny before it goes down, because babies swallow. That's all they do. They don't learn to spit till they're about 3. So asking a small child to spit out a deadly poison after you put it in their mouth is insane. Put anything in that baby's mouth that you wouldn't eat yourself. And if it says on the label, don't eat, then why are you putting it in the baby's mouth? It'll give them dental fluorosis, among other things. Never in children under age 6, it says on your toothpaste tube, and it has to be supervised to make sure they spit it out. So in supervised spit out test with fluoride, in children age 6 and older, they've shown that some children are able to spit out more than 50%, somewhere in the neighborhood of 50 to 60%. And so the new good thing to put on your toothbrush is half of a pea-sized amount, because that gives you about a milligram. And so that way, if they do swallow half a milligram, they don't throw up. That's why that warning was on there, because 10,000 children a year were contacting, or parents were contacting the poison control centers in the United States because of swallowed toothpaste. And swallowed toothpaste is going to go into your stomach. Whatever form it is, it turns into fluorine, because hydrochloric acid breaks whatever that is apart. It turns into fluorine, burns a hole in the stomach, or irritates the stomach lining, and you end up with nausea is the principal thing that people notice. And when I went to dental school, I was taught that topical fluoride was perfectly safe, and and we put a tray around the mouth, and you put a sucker inside, and you made sure that the client didn't swallow any of the toothpaste, or not toothpaste, but the topical stuff. And I was pretty big in preventive dentistry, and I kind of believed that stuff. Hey, I'd paid all this money to go to dental school, and there's a guy with a white coat in the front of the class, and got to know what he's talking about, because he's in a dental school. Those who can't teach. So I had a good friend, Craig, that was a chiropractor. And the chiropractors, when they go to school, they teach them that fluoride destroys joints, makes your back hurt, makes your kidneys hurt. It makes pain in your body. The principal symptom of fluoride overdose is pain, just plain old pain. And you can't tell where it's going to be, but it's pain. And that's incidentally also the symptom that we've identified in mercury is pain. The kidney pain, if it's damaging your kidney, head pain, if it's making your brain swell, muscle pain, if you got torticollis. One of my dental assistants, I hired her from another office, but she had a muscle in her back that she seriously considered having Botox shot into it because of the pain in her back, because the muscle was contracted. It's called torticollis. And, but that also happens to be painful, and only allows additional dosage information for children 13 to 14 years of age. So that the FDA warning told them that never under the age of 3, and only allows supplemental dosage ever 3 to 14. And the product is not approved. So not only is it unapproved, that it's given to unapproved populations, children, younger and older people. These products are all indicated for use down to the age of 6 months, is what the letter said. So that they're telling the Kirkman Laboratories that they have to change, cease and desist was what the letter said. And so they were basically following the dentist's guideline. Well, dentists aren't regulators. They don't get to determine what drugs get approved by the FDA. They can flap their lips and claim it's good, but then you got to put a rat in a cage, put fluoride in the water of this rat and some sugar in there, and you put fluoride and no sugar in that side, and you put just plain old water on that side, and you look and see who came out the best. Well, the rat that just has plain water comes out the best. So it would opposite of a therapeutic drug. It's a anti-therapeutic drug. A fluoride tablet is not a dosage form permissible, says the FDA. Well, wait a minute. What do we do with the tablet? We swallow it, right? Well, that's why it's not permitted. The only action that is recognized by the scientist as having any impact on the germs that live on your teeth is topical. So you don't swallow something to put it topically on your teeth. And so when you go to these city council meetings, and I would encourage you to all join in and participate in discussions at the local levels. And that people, I'm afraid I'll be attacked by the Dental Society. Oh, we will. And that is not true. They know they're lying. I've been talking like this for the last 30 years, and they have never attacked me, because I don't make grandiose statements like, if you swallow that, your hair will fall out. No, if you swallow that, my hair will fall out. I could prove it. So it's a good exercise in your civic duty because our profession is all wound up. They just had a meeting in Potsdam, New York, where all the dentists showed up and told them how good it was to have fluoride in the water supply and insulted anybody that disagreed with them. And why do they do that? Because the promoters of fluoride call around and they call you and say it's your professional obligation to come down here and support this wonderful public health measure. And they come down and they say things like, in one of them they said that the product added to the public water supply is pharmaceutical grade pure fluoride. We'll get into that in a minute, but that's not true. And that they make other claims. I like the one in Texarkana, Texas. I was invited down there to deal with the issue. And the dentist showed up in their old dirty smock. I mean, you know, what do you know about a dentist that's in a city council meeting that's got smuts on his smock? He's broken OSHA law completely because you can't leave the office with your clothing on because of infection control. You can't be there with a dirty old smock on. That guy said, I've been a dentist for now 22 years, and I ain't never seen any dental fluorosis. Oh, good to know. The CDC says it's over 60% of the children have dental fluorosis, so we would have to question his eyesight. Who wants a blind dentist? Keep making a noise, I can hear you. Where's the wet spot? And never in children under the age of 3. Unapproved new drug violations, no FDA approval, application on file. Wait a minute, don't you have to file an application? Oh, well, only if you're not in the dental profession. We don't pay any attention to that. That's just not important to us. So there's no FDA-approved application on file for the drugs listed. Marketing these drugs or new drugs without FDA approval violates the law. Misbranding. Multiple misbranding violations saying it's for young children and it's a tablet. And it goes on to say, you are responsible for investigating and determining the causes of violations identified above and for preventing their recurrence and occurrence of other violations. Well, I asked my dentist, and he said it was good. That's why I did that. But it's not news. I didn't know this until 95, 20 years after the FDA made this statement. When fluoride vitamins were withdrawn, Enzoflur, vitamin Enzoflur lozenges, so that you still got it, you know, topical, right? They were directed the company to stop selling this unapproved drug because there's no substantial evidence of drug effectiveness as prescribed, recommended, or suggested in the labeling. They said that in 1975 in the Federal Register, and it was published in Drug Therapy in the journal. So, gosh, I guess it's not FDA approved. When fluoride is added to the drinking water, fluoride comes out in the saliva and hardens the enamel and reduces tooth decay. That may sound a little far-fetched to you, and if it did, then you're correct. It's a false statement. And so, why was the baby that was breastfed so unlikely to develop dental fluorosis? And now I'm saying that it's false that the fluoride comes out in the saliva, and that's true, is because the breast milk and saliva contain almost no fluoride. Saliva is a filtrate of your serum. If your serum went up as high as the water, you're gonna die. So your body, when you drink a glass of fluoridated water, your body scrambles to park it in your bones. If you take in 2 molecules of fluoride right now, 1 molecule will be in your bones for the next 10 to 100 years, depending on whether or not you work out and turn the bone over while you're not exposed to any further fluoride. Because it's a very, very retentive poison, and it sticks in the bone. And that's why bone pathology, not tooth pathology, bone pathology, joint pathology, cartilage, is the first thing you look at to see if the society is impacted by swallowing too much fluoride. And the IAOMT has done exactly that. Only minimal amounts are found in saliva. Featherstone reported in 2000 in the Journal of the American Dollar Association that the amount of fluoride is too low, you're supposed to laugh there, too low, to show any measurable effect on the acid demineralization of the tooth. So when they come to the city council or they come before the dental society to give you a lecture about how good water fluoridation is, blah, 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 and they say, well, you swallow it and it comes out in your saliva, it bathes your teeth, blah, blah. Yeah, about like breast milk, and it's too low. There's zeros in front of it instead of the alleged beneficial level of 1 part per million, which is now dropped to 0.7. Tells you something, doesn't it? Got to tell you a quick story. That Socrates taught his students to differentiate between opinion and truth. And what he said was truth came from God. And that because truth never changes, because God never changes. Truth is eternal. It's permanent. It never flops around. And evil comes into society from what he called opinions. And opinions change like the wind. And so if you look at the opinions of the dental profession regarding fluoride, it's been changing. Have you noticed how it's been changing kind of like the wind? Is it at one point in time we were supposed to have 1.2 parts per million in the colder areas like Vermont, and we were supposed to have 0.7 parts per million down in Texas and other places where it's hot and people actually drink water. And when you come to find out, if you actually study up on the amount of water people drink, people down in Texas don't drink a lot more water than people up in Vermont. But this was somebody's theory about why we had different levels. And so when the dental fluorosis rate got up to 40%, the CDC announced that they were going to remove the higher level as a level that was permissible in the water supply. And my friend Doug Crago has been researching fluoride levels in water supplies in the United States. We claim to have 70% fluoridation in this country. And so there are reports. And if you go to the CDC, I think it's called My Water at the CDC, you can look up your community. And you can look up community after community after community, whole states, it's all 0.7, 0.7, 0.7, 0.7, 0.7, 0.7, 0.7. And then you contact the water supply and ask what's in there. Some of them don't have any fluoride in the water. Some of them have low-level fluoride in it. Some have 2, 1.5, 2 parts per million. It's all over the board. And Doug contacted him and said, hey, we got these water supplies all over the board, and some of them are above the level that is going to cause severe dental fluorosis. Severe dental fluorosis is where the pieces of your teeth are missing. So instead of just having a hole in the enamel, the whole corner of the tooth is missing, or there's a row across the tooth that doesn't fill in. So why are you not warning recipients of this water that they have to avoid giving it to children that are in the development stage of their teeth? And they said, well, we don't have a budget to do a real-time analysis. Apparently, they only got a budget to copy and paste 0.7. So they, if you can't believe them, who do we believe? Well, the water guy. Let's go ask him what he found. And Doug did that. He asked him what levels they found. And he said, well, they say we're supposed to try to keep it at 0.7, but we're lucky to keep it within about 2 or 3 points on either side. Huh? So you put a drug in the water that supposedly is fine-tuned for exactly what everybody needs, and you're going to keep it with about a 50% variation? What drug do you know you're supposed to take? Well, take some of it today and don't take any tomorrow, and take some the next day, and it doesn't make any difference how much you just take some of it. That's their attitude. How about this one? Children who have access to fluoride in drinking water have 40% fewer cavities than children who do not. Does anybody believe that? See, yeah, you're getting with me now. I heard the F word. So the other one would be an L word, lie. So blinded studies conducted in a manner consistent with scientifically valid by today's standard. That means you need to blind the investigators, otherwise you get what's called investigator bias. Have not found any significant difference in permanent tooth decay regardless of the amount of fluoride in the drinking water, according to the Cochrane review. And it went on to say, Cochrane review went on to say that water fluoridation, probably prevented tooth decay, but they couldn't find any modern studies. And their criteria for a study was broad-based blinded. They couldn't find any of those either. So, but they went on to pay lip service to the process because it's political. It's not scientific. It's political. And poor children have more decay than rich kids. And is that because their mother is wagging her finger saying, "You go in there and brush your teeth"? Or is it, "See you later"? So poor kids have a lot more tooth decay. 80% of the tooth decay is in 20% of the children. And there is no way you can put a drug in the water supply that would target that group. What you need to do is target that group with hygiene education and measure the bug that's causing the problem. It's a measurable bug. Spit in a tube, cook it at body temperature for 48 hours. If it turns purple, you got strep mutans in there. Kill it. Fluoride doesn't kill it. It just makes it sick for about 20 minutes. As a matter of fact, talk about ripoff. Go to the dental office, get a topical fluoride treatment. How long does that inhibit the process of causing tooth decay? About 20 minutes. About the same as a toothbrush with some toothpaste. Oh. So you're going to pay $16 for somebody to slop this stuff, a lethal dose of this terrible stuff in your mouth, and that's worth brushing your teeth for a minute, and you get a reduction for 20 minutes by making the germs on your teeth sick. Gosh, if it can make the germs on my teeth sick, do you think it might make me sick? Yeah. It doesn't quit being a poison because it's in your mouth. There's little contemporary evidence that met the review's criteria for inclusion. Nevertheless, we told you how good it was. How about this? Adults also benefit from systemic fluoride because it reduces the risks of hip fracture in the elderly and lowers the amount of root decay. You think that might be a reasonable thing? You know, fluoride accumulates in the bones. If it's going to make the teeth hard, it would make the hip hard, and you might be, able to reduce this hip fracture problem that seems to be, if you stand by the X-ray machine there at the airport, you'll notice that about every third person goes over here to be wanded because they've got a titanium knee or a titanium hip or a titanium shoulder or a titanium elbow or a titanium ear. Maybe they don't do ears yet. But so that's false. It doesn't help bones at all. And there was actually a study on that where the PAC, I think, was the one in Texas, and they had people that were osteoporotic, and they said, well, fluoride makes the bones harder. It makes them white on an X-ray. So let's give people a controlled dose of fluoride, and so they gave them 15 milligrams of fluoride by tablet. And they terminated the experiment early because all of the hip fractures were in the 15 milligram dose. None of them in the controls who received a placebo. So we have double-blind placebo-controlled studies showing that ingested fluoride increases hip fracture instead of the speculation that the advocates for fluoride says it reduces hip fracture. No, it does not. It makes the hip more opaque on an X-ray because it makes the bone form hydroxyapatite, fluorohydroxyapatite is what it forms. And so that's a weak substance, so the bone is abnormally dense but weak. So who wants weak bones? Hold your hand up, we'll give you some weak bones, 15 milligrams of fluoride. Nobody signed up for that. An increased risk of bone fractures and hip fractures. And what kind of quack organization developed this? Oh, the National Academies of Science. Now, I can roll you back. See, that's the 2006 review. The previous review was 1993, and it was written by dentists. And it was, oh, how good fluoride is. And it did have some information about dental fluorosis. But this review in 2006, they had a packed crowd of pro-fluoride people. Kumar, director of dentistry in California now, he was in New York at the time. O'Doul, remember when the question came out about smoking, whether it was bad for you, and there were all these studies showing that smoking made you stronger and healthier. Well, Dool was the guy publishing those. So they got the tobacco guy as the chairman, And the promoters are the 12 members of the committee. And there were 3 members of the committee, Bob Isaacson, Kathleen Thiessen, and Hardy Lineback, who were scientists. And so they kept saying things like, we'd like to see some evidence of that, and so forth and so on. And basically, if you read the book, and it's available online, the URL's on the bottom of your notes there, and I read it several times all the way through. And it's a marvelous review of the toxicology of fluoride. And it might put you to sleep the first couple times through, but it gets progressively more interesting because it's not about teeth. There's only one little section about teeth that Hardy Lineback wrote. All the rest is about, Bob Isaacson wrote about neurological impairment. I got to tell you about an experiment Bob did. This is not that hard an experiment. We could have done it in 1945. As a matter of fact, it was done in 43, but it's still classified top secret to this day. Top secret is only 50 years. 43 plus 50, 93, it should have come out. The government snatched it back, but they exposed rats to fluoride. So Bob Isaacson exposed rats to fluoride. And he kept hearing all this, oh, you're using too much fluoride, oh, you're doing too much of this. And at the time, and this was early 2000, so he decided he was going to do a low-dose fluoride. So he exposed rats to 1 part per million fluoride in their drinking water. And he took the fluoride out of their food and tracked them. And there were 2 kinds of fluoride that he used. He used aluminum fluoride, and aluminum fluoride, he used 0.5 parts per million aluminum fluoride, and the sodium fluoride, he used 2.2 milligrams per liter sodium fluoride. And so what he showed was that the control rats had no brain damage. Both the half a part per million aluminum fluoride and the 2.2 part per million sodium fluoride had lesions in their brain, arteries, and kidneys. And the kidneys were so badly impacted, they weren't certain that the brain damage wasn't due to the kidney damage, leaving abnormal elements in the blood circulation. So you can point this out. The alleged beneficial dose was 1 part per million fluoride, and then they say, oh, they grossly overdosed him with the 2.2. Well, you can say, how about the 0.5? Well, that's that aluminum. That'll hurt him. But let's back it up a little bit. Do you know what a dissociation constant is? A dissociation constant. I associated with somebody once. And the molecules of aluminum fluoride break apart rapidly in solution. So a half a part per million aluminum fluoride produces in solution 1 part per million fluoride. See, Bob's a scientist. And so he knew how to produce 1 part per million. The dentists that read that are not scientists. And so ignorantly, they alleged that Bob had overdosed the rats with 2.2 parts per million. No, he gave them 2.2 parts per million sodium fluoride because the dissociation constant is 2.2. 2.2 divided into 2.2, you get 1. Ha! He gave the rats 1 part per million. And they still lie about it. They don't know how to calculate dose, and now they don't even know how to calculate the dissociation of the molecule. The additive typically used in water fluoridation are pharmaceutically pure and free of any kind of contamination that may cause any unintended harm or lower the quality of the drinking water. Say, what's the answer to that? False. Louder? False. Do we know what they're putting in the water? Hydrofluosilicic acid is used in about 80% of the water supplies to 90% of them. And about 10% of them use sodium fluoride or sodium silicate fluoride, a powdered form, from China, Mexico, Japan, Holland, and Florida. So how come China and Japan and Mexico and Holland are selling the fluoride? Don't they want it? None of those countries allow fluoridation. So when industry produces a waste product, it piles up. But the Americans will buy it and put it in the water for the babies. Might explain some of the problems we have in our society today. Because if you damage the teeth, do you think you also damage the intellect? Probably. So we know that's false. and that the additives used are all. None of them are pharmaceutical grade. None of them are pharmaceutical grade. So the dentist that stood up and said it's a pharmaceutical grade product got a complaint filed with the dental board that he's making false statements to the public. I didn't know. Whose obligation is it for your lips to move in the right direction and tell the truth? It's not the dental board, it's not the public, it's the professional. So I didn't know. It does not cut it, because it's the obligation of the speaker who has a professional degree to tell the truth to the public, because there are prohibitions against making false statements. It's the elixir from the phosphate fertilizer pollution scrubber system. You run a bulldozer into a mountain, you pick up a bunch of limestone. You take it and you crunch it up and you pour phosphoric acid on it. And what comes off is hydrofluoric acid. And they used to leak that out into the Everglades and kill all the fish and stuff like that, and people got kind of irritated about that. So now they have chimneys, that they have scrubber systems. It's basically, it's like a coffin. So they bring the limestone in, they crunch it up, and they put the coffin lid on, they add the phosphoric acid, and what comes off is the hydrofluoric acid. And that is a little misters. You ever been to Las Vegas on a hot day? They got little misters all over the streets so you don't cook much. And that catches that silicon fluoride in a water solution, and that recirculates until it gets to be about 23% hydrofluoric acid. That stuff is so strong that in one of my documentaries, my YouTube channel, by the way, is David Kennedy DDS. And I had to fight with Google about my David Kennedy DDS channel. They said, we got to take professional degrees off everything. And I said, no. And so they went away. But one of the videos that you'll find there is a water worker who was in Arkansas. And the water fluoridation pump is, in his little town, is a thing, look, about the size of a water pick. You know, it's a little teeny thing, about the thing. And it just goes, it puts a little drop in there, and little drop in there, and as the water flows by. And so it's metering fluoride into the water supply. Well, this stuff, hydrofluoric acid, is not only highly contaminated with arsenic, lead, cadmium, uranium, and a potpourri of other stuff. We've just crunched up the earth and dissolved it in acid, so now you get whatever the earth is made out of, and you've added that to the water supply. But the silicon fluoride is extremely corrosive. And you can look at a picture of the room that this guy's working in, and all the pipes in the room are all corroded. The concrete is etched where the stuff gets on it. Eats concrete, yes it does, eats glass. And so the pump got eaten. And so they said, you know, Joe, it's time to change that pump. And so he had a replacement pump, because this isn't the first time the pump got eaten. And so he goes to the pump, he puts on his chemical gloves, and he puts on his chemical apron, he puts on his chemical goggles, he puts on his hood for his head, and he goes to the broken pump, and then he released the pressure downline so that there's no pressure on the pump, and then he unscrewed the little fitting. It's only like a 1/4-inch pipe. Unscrewed the little fitting, and it went psst, because the pump had broken and it had pressure inside it, and it squirted less than a half a cup on him. Most of it hit his goggles, his his nitrile apron, and his gloves, but he had underneath there a nice shirt, you know, like in wintertime. And the shower in that room was broken, so he sprinted to the next room and ripped off his clothing and took a shower and scrubbed his bare skin where it had spritzed with half a cup of this stuff. And then told his boss, you know, accident in the other room, and got sprayed with fluoride. And he said, oh, don't worry about it. It's not that big a deal. And but, you know, it's close to the end of your shift. You go ahead and head on home. And he said, okay. And he hopped in his pickup truck and started driving toward his house. And he got progressively more and more weak, and felt his heart slowing down. And he went by one of these big blue H's, and he said, hospital, and drove over to the hospital instead of home. He would have died if he'd gone home. His heart rate was down to 40 beats a minute. The way the fluoride kills you, it causes a heart attack. So it pulls the calcium out of your bloodstream so that your heart quits beating. So he went to the hospital and they stuck him on IV calcium. They should have injected his skin with calcium, but they didn't have that knowledge yet. But they kept his heart running. He's crippled to this day because the fluoride at that half a cup got into his joints. Hands look like this. Can't work. Oh, he just doesn't like work, and that's what his problem is. So blame the victim for the problem. You shouldn't have been crippled. So the additives are toxic at any level, and including 1 part per million. Here's another one. Systemic fluoride has been approved by the U.S. FDA as a drug suitable for use in children of any age, and we've covered that. And how about women during pregnancy? What's that? And, yep. And I was at a Grand Island, Nebraska, and Norfolk, Nebraska. And the Norfolk, Nebraska probably had the best fluoride debate, and that was before I knew how to make video. I'm really sorry, but I wished I had it, because it was a very well thought out process where they had a microphone and a stand over here for the advocate, the paid advocate I would add, for fluoridation. And over on this side, they had me and a guy with kidney failure. And and they had the public health nurse there. And so they were telling us how good it was to have fluoride, and that anybody who was opposed to it was a fluorophobe, and that it was, you know, you don't want to be one of the flat earth society people, and that, you know, only ignorance would keep the fluoride out of the water of Norfolk. And it was a shame that we had to have this hearing, because it was well approved and used in over 70% of the water supplies in the United States. And poor old Norfolk, Nebraska is so far behind the lines that, you know, it's really tough to understand why they hadn't implemented this wonderful public health service measure years ago. And the little old lady that came up to the microphone, and she said, well, I came here to find out, you know, what this was all about, and all I've heard this evening is insults and criticisms of me. And I don't know whether it's a good idea or not, but I know that I wouldn't have you for a neighbor. Sat back down. And another lady came up, and she said, I have 4 daughters, and they all are cavity-free, and they all had fluoride in their development. And that it's the wonderfulest thing that's ever come down the pike. And she didn't live in Norfolk. She'd driven over 30 miles from another town to tell us about how good fluoride was. And so Michael Weasley comments and says, well, that's another example of how great fluoride is. And so the way it was is that he got to comment and I got to comment. And so I got to comment, and I said, well, you're a dental hygienist. Did you teach your daughters to brush their teeth? Oh, yes, we're really good on that. So you think that had anything to do with the tooth decay? Well, I'm not really sure. And I said, do any of your children have any neurological impairments? She turned white and sat down. Her husband, the dentist, came up after the meeting and said, what do you mean about neurological impairment? I said, you know, fluoride's neurotoxin. So if you're really enthusiastic about slopping it around, especially during pregnancy, then you might have children that are impaired. And he said, my first daughter was born in the town I went to practice at after I graduated from dental school, and she has Down syndrome. And I gave my wife fluoride tablets to make sure her teeth were strong. I said, A, fluoride tablets aren't approved, and that could cause neurological impairment, but the Down syndrome is a broken chromosome. And Albert Schatz, back in 1977, showed that if the woman was exposed to fluoride during the gestation, she was a 21-year-old woman was as likely as a 45-year-old woman to have a Down syndrome baby if she was exposed to fluoride, because fluoride breaks chromosomes. It ages the egg. That's what Down is. It's an old egg. And so I happen to have that study in my briefcase, and so I sent him off. He hasn't shown up at any more meetings telling us how good fluoride was. But it's a shame, because he should show up at meetings and tell how bad it is. And I think that's the big problem, is that if you have the courage to show up and tell the city council your heartfelt belief, and you, through your own research or by delving deeper into the information, discover that your heartfelt belief was not true, then I think you're equally obligated to go out and tell the rest of the world that your heartfelt belief is now that it's a very toxic substance and you should avoid it, which is the position of the IAOMT, is avoid it wherever possible. And so you see there's a little reference on the bottom here, and that Bashish did a study funded by the National Institute of Health. It was a 12-year study where they measured the maternal urinary output of fluoride. Now, why would you want to measure a woman's excretion of fluoride through the urine? Because half the fluoride you take in is going out through your urine. So if you measure the urinary output, then you know what the intake was. So if you're squirting out 1 milligram a day in your urine, then you swallowed 2, right? That's just exactly right. And so what they showed was, for every 1 part per million in the urine, there was a 6-point drop in IQ. Do you know what that means to our society? 6 points? So if the average gardener has an IQ of 100, the 6-point drop makes them able to run a broom. They're never going to write a computer program. They're never going to become a air traffic controller. They're going to be locked in the 94 IQ jobs. And that's not bad for them, it's bad for our society. Because what happens is, if you look at our society, we have a bell-shaped curve of IQ. And over here, we have the Boyd Haleys, clear over here with the 150s and the 160s. And over here, you got the people that are kind of impaired. We got to take care of them because they can't seem to figure out what day it is. But if you move that bell 6 points to the left, what you do is you lose 80% of your geniuses, and you have an 80% increase in your lower IQ. Is that what you want to do to your society? Kind of move all the IQs to the bozos? Uh-oh. So, and who says you only get 1 milligram? What if you happen to like Coca-Cola, and you go to the store and you get one of those nice big 2-liter Coca-Colas? Well, there's just as much fluoride in a Coca-Cola as there is in tap water. In some cases, more. And how did it get in there? It is the pesticide on the syrup they use to make the Coke. It's so high in the syrup, it ends up higher in the Coca-Cola. So there's no control over how much fluoride beverages you drink. Because if you drink tea, there are studies showing that women that drink tea on a regular basis, black tea and green tea, chamomile tea, those are the 3 that are high in fluoride, they too have a higher incidence of lower IQ children. This is for every 1 part per million increase in fluoride in pregnant women's urine reduced their IQ on average 5 to 6 points. The effect of fluoride persisted even after adjusting for numerous potential confounding factors, including lead, smoking, alcohol, social economic status, and birth weight. The international study, one of the most rigorous ever conducted in this area of fluoride's neurotoxicity, was funded by the National Institute of Health and led by the University of Toronto School of Public Health, collaborating with Harvard, Michigan, Indiana, McGill, and the National Institute of Public Health of Mexico. This study further validates hundreds of other studies finding fluoride's neurotoxic effects, many at doses experienced in fluoridated communities. That's their words. Neurotoxic at levels experienced in fluoridated communities. Like, where did we fly into yesterday? It's fluoride in that water. Here's another one. Chronic exposure to fluoride in their drinking water at 4 parts per million, a level above which the amount, a level far above the amount recommended for optimal decay prevention, has never harmed anyone. Well, I think you probably know what that answer is then. And that NRC review identified adults drinking 4 parts per million for arthritic-like symptoms, bone fractures, thyroid suppression, especially in iodine-deficient infants. And so when I worked at UCSD, I worked with a professor named Gerhard Schrauser. And Dr. Schrauser was number 13 in the founding of the University of San Diego. And Schrauser was the chairman of the Department of Chemistry. And he was famous for accusing me of being a zero-tolerance kind of guy. And the other thing he always said was, it's never one thing. It's never one thing. Toxicology never deals with one thing. It's always multiple things. And he's also famous for discovering that selenium mitigates cancer. Has anybody been running around saying, boy, I need some selenium, I'd like to prevent some cancer? It's in the scientific literature. How come you don't know that? Because we don't prevent in this country. We medicate after you get it. And so if you had colon cancer, like my wife did a few years ago, she went to the oncologist after the surgeon had removed this horrible big tumor. And the oncologist said, well, you know, you're going to die if you don't do this chemo. And the question I had was, well, what chemotherapeutic agent are you considering? He said, oh, well, the standard is 5-fluorouracil. I said, 5-fluorouracil. 5-uracil, the fluoride. So you've taken DNA and stuck a fluoride molecule on it, which makes all the DNA blow up, so the body can make no new cells. Yeah, that's right. 5-fluorouracil. And he was wagging her finger, and Betty, kind of a strong woman, she says, I've worked with men in real estate who wag their fingers, and he says, they're always lying. And so we went the other way, and I stuck her in a stainless steel tube with hyperbaric oxygen, and Dr. Novak ran copious quantities of IV vitamin C, and her cancer went away. And I pointed out to her some years later that her oncologist died at 65. She lived to be 85 and died of a heart attack, but she didn't have any cancer. So, NRC review, adults are at risk of arthritic-like symptoms. In my film on the 4 part per million, I pointed out the couple, elderly couple in China, they were in the 60s, and they're both walking around like this, and they can't stand up. But, you know, mom picks up a dish rag and throws it in the window of her mud hut, and dad's walking around like that. And the chicken is walking around like this. And my camera lady says, the chicken's even crippled. So 4 parts per million, never hurt anybody except the chicken, bad for chickens. And actually chicken is high in fluoride. We measured a lot of stuff. And when I first got in this issue, I wasn't particularly concerned about it. And I actually, like I said, I wrote my nieces and nephews prescriptions for fluoride in the 80s, and fortunately, my sister-in-law was smart enough to throw them away. Never filled them. She still makes fun of that. And so the chickens, and so we measured Gerber's graduate chicken. Let's see, what is it called? Deboned chicken. And it's a Tender Harvest is what they're called, their organic brand. So you think organic, that no pesticides on those chickens, that's going to be a pretty good food for your baby. The baby food was 8 parts per million fluoride. There's absolutely no control whatsoever of how much fluoride is in the food you eat because it's the residue of a pesticide, cryolite, sodium aluminum fluoride, that they spray all over everything, especially grapes. So you find high levels in most wines, especially in California, not so much on the coast, but mainly the inland places use more fluoride. So you'll find a wide exposure to fluoride in almost every beverage you can buy in a store, except distilled water. This is a good book to read. I gave you the URL. So their conclusions were unanimous: hip fracture and bone pathology, those with weak kidney functions. Now, we got to this other issue of you're going to excrete fluoride. Well, if you don't have good kidney function, you don't excrete fluoride. So people who are on kidney dialysis, 13% of the population in the United States today have impaired kidney function. So the fluoride that they're exposed to does not leave their body. So they get sick twice as fast because their intake has no outgo. Evidence of neurotoxicity, this is 2006, endocrine disruption. And that was, and back to that when I was saying, you know, it's never one thing. If you go to chapter 8, table 8-2 in the National Research Council review of fluoride, you will find a very detailed list of the doses from studies that they felt were worthy of note and publication, and they were reasonably well done scientific studies. And they noted that wherever iodine was deficient in the recipient of the fluoride, that the impact was much more severe, almost doubles the amount of severity. And what kind of impact? Primarily on the thyroid. And that we used, when I was in school, somebody who was born to a woman that was deficient in iodine, the child might have what was called cretinism. Today they call it impaired neurological development. But basically, the kid's a bozo. And that's because the iodine is essential for the growth and development of the neurological system, and it's the antidote to fluoride exposure. So if you happen to live in a part of the United States where the iodine level is low and the fluoride level is high, that you are likely to cause neurological impairment. So anyway, that's called endocrine dysfunction. That means your thyroid doesn't work. So what happens when your thyroid doesn't work? Well, let's see. I think you get heart attack is one of the things, and obesity is another, and as we talked about, the intellect is another. And iodine low also is linked to breast cancer and breast dysplasias. We had wonderful lectures at this academy from Sherry Tenpenny, and if you want to read a wonderful, wonderful blog about iodine, write down Tenpenny, T-E-N-P-E-N-N-Y, S-H-E-E-R-R-Y, S-H-E-R-R-Y, Sherry Tenpenny, and Dio, and she goes through in detail how she's healed lumpy breasts that had cystic dysplasias by putting them on high-dose iodine. Has anybody ever died from drinking too much iodine? Not to my knowledge. And then there was the guy that was driving the Corvette a little too fast, and he hit the bridge abutment and took the top of his head off, and lying there dying, and they picked him up and took him to the hospital, and they looked in his wallet, and no, organ donor. So he called the organ transplant team, and they came in and said, this guy's going to die in a few minutes. Get ready, he's an organ donor. We got a heart, we got a lung, we got all kinds of good parts. And so he didn't die right away. And the surgeon was kind of walking around like this saying, you know, when's this guy going to kick off? And so he had a golf gate, and so he kind of reached over here, and what do you have in an ER? You know, he's got a bottle of iodine. So he put a funnel in the guy's mouth and poured the bottle of iodine in there. And the nurse snuck out the back and called the sheriff. And so they arrested him for attempted murder. Had he poured fluoride in there, the guy would have died. Didn't kill the guy. So we know that pouring a quart of iodine down somebody doesn't kill him. Certainly ruined that guy's career, though. So don't be impatient. Organ donors will donate when they pass. And endocrine dysfunction. Carcinogenicity. The rats that, it's in my video called Fluoride Gate, but the rats that drank fluoridated water, ordered by Congress in 1977, not done until 1989, and that the rats that had exposure to the highest dose, which was 79 parts per million. Remember the toothpaste? It was 1,000 to 1,500. Okay, the rats that have 79 had cancer of their lip. How do you get cancer of your lip? By putting it on the little spigot to get a drink. So 79 parts per million on your lip of a rat caused cancer. But it also caused dysplasias in the mouth, the throat, the liver, and the bones. It's a powerful carcinogen. And that went to the very group that Congress did not trust to do the study in the first place, the United States Public Health Service. And they changed every single cancer. If I had cancer, I would get them to fix it because they just pencil whipped it, and every cancer those rats had went away. Down 2 levels, not just 1, but 2. So carcinoma in situ became dysplasias. You have chapped lips. You just have a chapped lip. They couldn't make the bone cancer go away, so they took the biggest bone cancer and they said, this bone cancer is so big, it couldn't possibly be a bone cancer because the rat would have died. And just threw it out, and that got it down to the point where they didn't have to tell you to take all the fluoride in the world and get it out of our water supplies. And that's called phony baloney, and that's Washington, D.C. and the Public Health Service, because the Public Health Service is a branch of the military. Did you know that? They follow orders. So if you work for the Public Health Service and you don't promote fluoride, you get fired. It's a branch of the military. Or is it the mafia? Military. Fluoride in the water causes dental fluorosis, says the National Academy of Science. Here's the neurotoxicity. Fluoride's more toxic than lead and just a hair less toxic than arsenic. And that why did they say it was neurotoxic? Is because there's human, animal, and its neurochemical effects. Lancet, Grangine, and said fluoride should be classified as a neurotoxin just like mercury and lead. Furthermore, untested chemicals, and I like this one, untested chemicals should not be presumed to be safe to brain development, and chemicals in existing use and all new chemicals therefore must be tested for developmental neurotoxicity. Because there are unintended consequences. I can tell you in 1945, nobody knew this stuff. This was not common knowledge in 1945. And so that's when they began to put fluoride in the water supply. Why would they do that? Look into it a little deeper and you'll find that there was a lot of fluoride piled up from making the nuclear weapons. Because we don't need phosphate on our farms. It makes these great big tomatoes that don't taste like anything. It's good for agribiz because it makes big fat tomatoes you sell. But it doesn't make them tasty. But they had to grind up a bunch of limestone to get enough uranium to make a bomb that blew up. And so if you can imagine taking a mountain down in order to find a cup full of uranium, what's that mountain? What do you have left over? You got silicofluoride and you got gypsum. What do we do with gypsum? Well, plaster of Paris, we take it, we make molds with it, or we put it on a piece of paper and put it on the walls. And so you think about what that solution is, dilution. We take a big pile of gypsum and we make walls with it. Oh, okay, that's good. It gets rid of it somehow. And they came up with this story about how fluoride in the water was good for you. And because dentists don't question authority. Remember when you tried to question authority in dental school and you were shouted down? You stop asking those questions, you student radical. I actually told Steve Hott that Bob Barkley talked to our dental school in '67, and Bob talked about preventive dentistry and how to, stop tooth decay. And, we were pretty well along in our first year, and we'd never heard that before. So the students, our class president was Steve Hott, a lifer in the Air Force. And so we asked Steve to go down and check with the dean and see if what we'd learned at that all-student seminar about preventive dentistry was correct, that germs were causing tooth decay. It wasn't just diet, it was germs and scum on your teeth and things that swam around the gums and ate the bone. And that was what we needed to focus on instead of grinding holes and sticking mercury in it. We needed to make the mouth healthy. And so we sent Steve down to ask H.B.G. Robinson, our dean, at the UMKC, whether or not that what we'd learned from Dr. Barkley was correct or not. And so he couched it in a very, very kind and considerate manner that, the students at the satellite school where we're in the freshman class are not around all of the professors and the knowledgeable scientists that you have down here at the greater school. And that we were sent down here, I was sent down here to ask you if the information that was in the all-student assembly was indeed something that you agreed with and factual. And he said, HBG began to kind of froth and foam at the mouth and then began to wag his finger and said, "You student radical, get out of this office. You'll find out next year." Steve is probably as far from a student radical as there ever was. Fluoride in the drinking water may trigger depression, weight gain, warn the scientist in the Telegraph, that's in English. Failure to support community water fluoridation violates the dentist's professional and ethical obligation to the community. This is the one they use to get you to come to the meeting and lie. Is that true? No. You're obligated to tell the truth. Fluoride has never been shown to be neurotoxic. True? No. National Research Council essential report about the fluoride from 2006 recommends setting a lower level of fluoride. Have they done that? Let's see. If I got a recommendation in 2006, it's 2007, 8, 9, okay, that's 12 years ago. How long does it take the EPA to develop a new drinking water standard that would be protective of an infant? Do you know what the drinking water standard for fluoride that protects an infant would be? It would be the same as breast milk. Well, hey, that would stop the import of fluoride from China, Mexico, Japan. The antidote to chronic fluoride overdose is a combination of essential nutrients, including vitamin C, iodine, magnesium, and selenium. Who believes that? Is that true or false? True. Oh, you guys are too smart. Selenium is also the antidote to mercury poisoning. Iodine is also the antidote to mercury poisoning. Did you know that? This is a real simple study. They took people who were just off the street, gave them in a blinded fashion tablets of iodine or tablets of nothing, and they measured their urinary output of mercury. And when they gave the ones that got iodine, they started peeing out mercury. Who knew? Like Strauser said, it's never one thing. It's all of the above. It's never one thing. Early demonstrations of fluoride effectiveness were reproduced in hundreds, and I've heard thousands. I think Michael Weasley said there were 30,000 studies of subsequent randomized controlled clinical trials. Is that true? What did you put down on your paper? I got one lady over here's got it. Anybody else? Okay, we've got 4 people that know it's false. And so the reason that other scientists have not been able to reproduce the early U.S. studies is because they were faked. You want to read a good book, I will send you a PDF of a dentist book by R.N. Sutton, an Australian dentist. And before he went to dental school, he was a statistician. And so he started looking at, began to question, it's kind of like Alice in Wonderland, when you look behind the curtain and, there's a little guy with a microphone, you say, well, say, maybe everything I learned in school wasn't quite right. And so you start picking apart everything. And I would question everything you learn in school because schools do not teach the truth. They teach the dogma. So dental schools are indoctrination, not education. That if you deviate from the message that the professor wants you to hear in the school, they will shout you down or kick you out. It's very similar to the public health service, sort of a military approach to knowledge. You will do what we say. So they were faked by the military in order to promote disposal of fluoride and they used the national security trump card saying we had to in order to keep ahead of the Russians in making nuclear weapons. And besides, it was good for your teeth. How about this? The majority of developed countries use water fluoridation in their dental disease prevention programs. I heard that. False. Not correct. Never. Worldwide tooth decay decline has been far greater in the countries that implemented this simple, safe, cost-effective program of water fluoride supplementation. False, yeah. And that's a graph, and it goes on and on. You can get this off of the internet. This is the World Health Organization collecting data on tooth decay for the last, 65 till now. And you can't tell me which country has fluoride in the water supply, unless you look at the legend and the red ones have, and it's incorrect. If you look at the dashed line, it says Germany. that was East Germany when this data was collected. And when East Germany combined with West Germany and it became Germany again, they stopped all fluoridation in the communist bloc, and tooth decay went down in East Germany when it joined West Germany. So, no, tooth decay has declined worldwide for the last 50 years, and that's because we have ads for toothpaste. We have a knowledge that a stinky breath irritates the girls, and so some of the, my dad came home one time, Dad was a dentist, and he came home one time and there was an ad on TV at the time, and for Pepsodent, and it was like, you wonder where the yellow went when you brush your teeth with Pepsodent. He came home and he said, I found out where the yellow went. The patient had about an inch of scum on his teeth. Anyway, no more wondering where the yellow went. So anyway, so when you look at a graph like this that shows that there really has been a tremendous decline, I'm reminded of the time that we were at the city council in San Diego, and an older dentist from Chula Vista came up, and he took the stand and explained that the fluoride has been the best godsend for dentistry. I've been in dentistry for more than 55 years, and when I started, there was a tremendous problem with tooth decay, and because of the fluoride in the water supplies in Chula Vista, it has dropped tremendously. I hardly see anywhere near the number of cavities I used to see back when I first graduated from dental school back in 1938, and it's just a wonderful thing to have in the water, and it's just been so good for the kids, and it's just such a wonderful, wonderful thing. And I pointed out to him, I said, Chula Vista doesn't have fluoride in the water supply. And he goes, it had to be. What else could it be? How about nutrition? We've got refrigerators now. You got fresh fruits and vegetables in all your stores. You got lettuce in Kansas in the winter. How did it get there? It flew there. So that's why you have to do blinded studies, because the operator's bias will make them reach conclusions that are idiotic because they want to believe what they learned in school was correct, and it isn't. Adding fluoride to the drinking water has been found morally ethical by scholars because the benefits far outweigh any minimal risks. Yeah, right. You can't give somebody a drug without their consent. So where's the informed consent? Did you tell them I was going to give you a deadly poison that's contaminated with arsenic, lead, and cadmium? No. It's not, no. The FDA says it's not an approved drug, but it does say it is a drug. So the question is fluoride a drug? It's any substance that treats or ameliorates or is claimed to treat or ameliorate a disease of man or animal is a drug regulated by the Food and Drug Administration. So by refusing to approve it, it becomes an unapproved drug because it just claims to treat. It's kind of like zeolite. It's claimed to remove mercury. Did you ever measure mercury coming out? There's a claim for it, but not a data. Fluoride in toothpaste reduces tooth decay by impairing the respiratory system of the germs that ferment carbohydrates so they produce less acid. Your opinion? Are you true? Is it true? Yeah, true. Why does it inhibit the respiratory system of the germs? Fluoride inhibits every enzyme system known to mankind. That's how it poisons you. It stops your body from working. We're all enzymes. Every mitochondria produces energy with enzymes. Every enzyme tested so far is inhibited by fluoride, even those with and without metal covalent. So it makes the germ sick. Could it make you sick? Babies can tolerate substantial exposure to fluoride. False. Because they're so small, they can't take it. The first outward visible sign of fluoride overdose during tooth development is dental fluorosis. The first outward visible sign of fluoride overdose during tooth development is dental fluorosis. True? False? True? You're right. I had somebody that was, I think, 40 and said that she got a topical fluoride treatment. The dental office has developed dental fluorosis from it. And I tried to explain to her that dental fluorosis is a developmental problem rather than a systemic problem, and that she couldn't get that. She said, no, my teeth were fine until I got the topical treatment, and now they're, nope. Dental fluorosis is the developmental anomaly. Today in Florida communities, less than 10% of the children display any sign of even minimal dental fluorosis. There you go. It's up to 80% now. And so it's not an essential nutrient. Incorporating the enamel has no measurable impact. The reason for fluoride is not approved is because it doesn't work that way. Here's that nice graph I was going to show you about from table H-2. There's your altered thyroid function, iodine deficiency. There's your graph of it. I think this is the dental fluorosis rate in the United States. It's gone steadily up since we began our intervention to reduce tooth decay. Tooth decay goes up, dental fluorosis goes up. More gimmicks, claims adults benefit as well, and they can't produce a single solitary scientific study to show that. The review, they voted unanimously to reject the 4 ppm level. For MCLG is the level you can drink for a lifetime with no adverse effects. It shouldn't take 20 years to come up with the truth. Death, nausea, vomiting, dermatitis. Is it a neurotoxin? Yep, we've heard from Bob Carton, Phyllis Molinex, Bill Marcus, Bob Isaacson, and Carl Jensen. All of those scientists said yes, it's a neurotoxin. They were faked. I can send you PDFs of all of this stuff. Oh, by the way, this is the only large, broad-based study of the United States, 39,000 children. You see which area was fluoridated? No, you don't, because there's no difference between those graphs. Luxembourg says, in our view, drinking water isn't suitable for medical treatment, and that people need additional fluoride. They can decide on their own what's most appropriate. I'm going to stop there because I see that we're getting ready for our next speakers and our next break. But I don't want to destroy your favorite way to prevent tooth decay, so I'm going to give you just one little pearl that we can talk about more in detail later, is that germs that cause tooth decay can't stand iodine. So you can get tooth decay to disappear by disinfecting the mouth. So become a modern doctor, find out what the germ name is, and kill it. That's my message.